Going forward, we are now encouraging that Rhode Islanders can start wearing face coverings in public. Face coverings are different from regular medical masks, whether they are N95 face masks or other types of surgical face masks. At this time, people in the general public should not be purchasing or hoarding medical-grade masks, such as the surgical face masks or N95s, which are in short supply but are being addressed every day. Instead, we are encouraging that people can wear cloth face coverings. A cloth face covering is a material that can cover the nose and mouth. It can be secured to the head with ties or straps, or simply wrapped around the lower face. It can be made of a variety of cloth materials. A cloth face covering could be sewn by hand or can be improvised from household items such as scarves or t-shirts. So let's talk for a minute about why we are recommending this. The primary role of a cloth face covering is to reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes. That may include people who have COVID-19 or some other viral illness, but may not yet feel those symptoms and may otherwise feel well enough to go out. We know the message is and will continue to be that if you are sick with symptoms, you need to stay home. Just because you have a cloth face covering does not mean it is acceptable for you to go out with symptoms. We want to do our part to limit the spread of respiratory droplets when people are in the community and in public. And we recognize that there may be times people are not aware that they have some of those mild symptoms. And so being able to cover yourself helps protect from other people being exposed. This face cover encouragement is a shift because of how atypical the COVID-19 symptoms are, as I discussed earlier. A very critical message to this is that cloth face coverings are not substitutes for any of the evidence-based approaches that we have been mandating as required. That is the social distancing, standing 6 feet apart wherever you are, washing your hands regularly and using hand sanitizer, and staying home when you are ill. Those are the proven approaches to work, and they must not be replaced by still going out when ill, not washing your hands, or not abiding by the social distancing requirements that we have expressed and that the governor has issued through the stay-at-home order. It's a good idea as well to wash your cloth face covering frequently, ideally after each use or at least daily. Have a bag or bin to keep cloth face coverings in until they can be laundered with detergent and hot water and dried on a hot cycle in the dryer. If you must rewear your cloth face covering before washing, it's important to wash your hands immediately after putting it back on and avoid touching your face.